Welcome. It is Ask Dr. Geier Live. Wherever you're watching, I hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This is that one time and one place every month where I answer your questions. Whether it's a surgery, rehab, recovery, basic what is this injury type of question, or if it's regenerative orthopedics and regenerative medicine, peptides, exosomes, PRP, that type of thing, this is the place to ask. As always, a few sort of housekeeping notes before we get started. One, this is not meant to be medical advice. It is not medical advice. I legally cannot give you medical advice online. I haven't seen you, haven't examined you, haven't looked at x-rays, MRIs, any of that. So if you need specific medical advice, please talk to your doctor. But I can help translate what your doctor said or give you information that then you take to your doctor and make the decision that's best for you. Also, if you're watching and you have a question that you want to ask it in the chat on YouTube. I cannot see it in the comments below this video. I can only see what's in the chat. That's what comes to me through eCam, which is what sends this feed out there. So leave it in the chat. If you don't know where that is, look for this question from Pamela, which I'll answer in a second. Look for that on the screen on a desktop and laptop, at least. It's on the right side, not 100% sure on a phone, but look for hers. Ask it right under that. That's what comes through to me. Also, if you're a military veteran and you have a question about a disability claim, I do those, but in a different show that starts at 5:30, Veteran Nexus Letter Live. That's a different YouTube channel. Look for Veteran Nexus Letters with Dr. David Geier. You'll see the link for that show that will start at 5:30. But I will stay as long as there are injury, orthopedic type questions here, which can be a few minutes. That can be longer than that. Sometimes we get lots of questions. So I will leave it at that. But definitely want to help as much as I can. Very grateful that you are here. So since I put it on the screen, let's start with Pamela. I had surgery 5 months ago, had a plate and screws put right under my knee. Can you recommend exercises or vitamins so scar tissue doesn't build up until I can strengthen and walk again? So it's a legit question, and I appreciate that very much. I think what she's talking about is scar tissue within the knee that develops, what's called arthrofibrosis, and that's a very, very big problem once it happens. And usually is related to lack of mobility. If you put somebody in a brace or cast or something that leaves their knee all the way straight, that can happen very quickly. So it's important. To be fair, I don't know that there's any vitamins, any nutritional supplements that have been proven to be linked to causing it or preventing it. So I don't know that there would be much I have to say there. What I would strongly recommend, and again, it's hard to know because I don't know what your weight-bearing status is or what rehab protocols they sort of put you under, but strongly advise patients after knee surgery to get their knee moving fully straight, bending it back as quickly as possible. A lot of times that requires working with a physical therapist because the quicker you get that motion back, the less likely that scar tissue sets in, which becomes a big problem. So the sooner, ideally you want to get full range of motion back of the knee within 6 weeks even, if possible. And that can be hard to do on your own. And so a lot of times working with a physical therapist can be very important to do that. Once scar tissue starts to build up in the knee, yes, there are surgeries where a surgeon can go in and clean out scar tissue. I did that for a number of people, either secondary to a surgery I did or secondary to a surgery somebody else did, but it is very hard to get full motion back once that arthrofibrosis, once that scar tissue sets up. Even if you clean the scar tissue out, it's a really tricky problem. It's a much better problem to prevent than to treat once it happens. So exercise, range of motion, and doing that with a physical therapist is what I would strongly recommend. Are there any peptides you like for weight loss outside of the GLP-1s? I don't know that any of them work as well as the GLP-1s, albeit, yes, as everybody knows, have some side effects. And before I say this, anything, I should have said this in the opener, when I talk regenerative orthopedics and regenerative medicine, whether it's peptides, as in, who was that, Mike? Whether it's his question or anybody else's, anything that's experimental by the FDA is just that. I'm not promoting it. I'm not saying you should do it. I'm just putting the information out there. I have been certified in peptide therapy by the International Peptide Society, so I know this stuff pretty well. But talk to your doctor about it, especially when we're talking about, in the case of some of these peptides, not the GLP-1s like Ozempic, Wegovy, Mounjaro, but when you're talking about some of the other peptides that are considered experimental, you definitely want to get them prescribed by a doctor, preferably somebody that is certified in this, and that they come from legitimate compounding pharmacies, not from these companies, these labs that sell peptides online. There are some peptides that have shown some weight loss characteristics to them, even if that wasn't the primary focus of the peptide. Some of the HGH releasing peptides like CJC 1295, AOD 9604 both do that. Also, MOD-SC in some studies has shown some weight loss. I think there's other reasons that those can be beneficial, probably more so than weight loss, but I think those could do it. I don't know that if the goal is purely weight loss that they would necessarily work as well as the semaglutide or tirzepatide would, in my estimation. You might get different answers on that, but those would be ones you might look at outside of the semaglutide, tirzepatide. Jay Liriano says, hi to you. And then, can you beat hip arthritis? They want me to have a hip replacement. I don't know that, I guess it depends on what you mean by beat arthritis. I think we, even in the world of regenerative treatments, and I'm a big believer in that, we have yet to figure out a way to completely reverse arthritis back to the way that a hip or knee was when you're 16 or 18 years old. We do think that there are treatments that can increase cartilage thickness, increase strength and thickness of the subchondral bone under the cartilage, but it probably doesn't completely reverse the damage. A lot of the regenerative treatments also, the studies show better results at pain relief more so than regenerating cartilage and bone, but still beneficial. There's so many reasons, as I've done both in these live shows and videos on my channel, about the downsides of things like cortisone and some of the traditional treatments, that I think things like peptides, things like PRP, like exosomes can be very beneficial. A medication that's right now used off-label, short-term use of something like penisin polysulfate, all could be helpful. Does that mean you reverse arthritis? No, probably not. Maybe a slight bit, but probably not completely. But can you slow down or stop the progression of it? I think there's better evidence of that. Can you decrease pain from it and improve function despite the hip arthritis? I think that those can do very well. I mean, there's a lot of variables and it's not a one-size-fits-all thing, but yeah, I do think you can certainly delay joint replacements for a good bit of time with a lot of those treatments. All right, Mike says, my right shoulder feels like it's getting pinched, irritated when I do delt raises. Any thoughts on exercises to help with that? It's 2 out of 10 pain. Don't want it to get worse. It really depends on what it is, and this is where just sort of answering questions can be tricky. That'd be something I'd want to examine and see if I could figure out what is causing that. My guess is, especially in somebody that's active and going to the gym, and it's probably not structural damage like a rotator cuff tear or labral tear or something like that. My guess is, and again, this is not medical advice because I haven't seen you, but it sounds like it's more of a shoulder impingement where you get pain when you reach up into overhead positions or out away from your body, sometimes behind your back. And there are exercises to help overcome that, not just rotator cuff strengthening exercises, but strengthening the periscapular muscles around your shoulder blade. Not so much deltoid and chest strengthening, but little tiny stabilizing muscles. Usually you can do them with bands. What I would recommend, so people ask sometimes, what are the exercises, or are there YouTube channels I can get them? And I feel this way, and I know a lot of the really good physical therapists that I know feel this way, that you can sometimes even do more harm than good that way if you don't do the exercises with the proper technique. So what I would recommend is find a really good physical therapist, works with a lot of athletes, does a lot of shoulder rehab, and see if you can work with him or her one time. Maybe pay a cash fee for one time or insurance one time. Get a comprehensive exam by that physical therapist and let them design a program of 6 to 8 exercises that then you do every day on your own, so you're not going there 2 or 3 times a week, because there are things you can do, but make sure they watch you do those exercises and that they correct your technique so you're not just flailing your arm, because you can, and I have seen it many times in my career where people just tried to do some exercises that somebody showed them or they got online, but they didn't really know what they were doing and ended up making their shoulder pain worse. That's what I have my patients typically do, and I think it works typically pretty well. Let's see, Cindy, I have pain in distal left leg. Is it okay to be rotated like this? Can it be repaired? I don't know if this is related to something else I saw and maybe I missed it. I don't know what the rotation or what the injury is, so I'm not 100% sure. If you want to give me more information on that, I'll give you my thoughts. Pamela, what causes stiffness after surgery? Is it caused by scar tissue? So it can be scar tissue, but it can also be just immobility, not moving the knee, and then the muscles around it get tight because they're basically sitting in one position, not being stretched to full length. And so that's where home exercises and that you do multiple times a day on your own, and physical therapy maybe twice a week, can be really helpful to prevent knee stiffness. The knee is not as bad as maybe the elbow, but there are a number of joints. The less you use them, the stiffer they're going to get, and the longer it's stiff, the harder it is to get that range of motion back. So I think that is very important. She says part 1 is above. I'm not seeing part 1 though. I don't know. Maybe that one didn't come through. Live Louder Project. MRI, partial thickness myotendinous tear of the sternal head of the left pec major with fatty infiltration, 15 months. Yeah, that's a tough problem. The pec major, the big chest muscle tendon injuries, typically need to be fixed. Muscle injuries here a lot of times can heal without surgery, but if it's a tendon avulsion of the arm, that typically doesn't do all that well, especially in the chronic. I don't know if that's what's going on, but it's what it sounds like. That becomes a tricky problem once that tendon has basically not healed, and now you develop atrophy in that chest muscle. So depending on the severity of it, could some sort of reconstructive surgery where they rebuild that tendon be helpful? That's what's hard to know. But for somebody that just tears the pec injury, it is not always an injury that just give it time and it'll do fine. If that tendon is pulled off the humerus, very often that needs to be fixed. Hopefully that's not what happened in your case. But I think I'd want to find out, be it MRI, shoulder specialist evaluating you, that kind of thing, to try to figure that out. And he says, like your advice. Again, it's not medical advice, but I very much appreciate it. Mike says, thank you. I appreciate it. And again, Cindy, I don't see part 1. So if you want to resend me that, again, I'm not on YouTube. These are all coming through eCam. So I can only answer what's coming through to me. I'll give you a couple minutes to do that, or anybody else that has a question. If you're potentially interested in seeing me as a patient, and this show is not to promote my practice, but I get a number of people that reach out and say, hey, I want to hear about options other than cortisone, other than physical therapy, and definitely other than surgery. Sometimes it's regenerative options and things like that. I'm certainly happy to help. There's a link in the description under this video that takes you to a contact form on my website. Just fill that out, describe your injury, that kind of thing, and I can talk to you about potentially how we might be able to work together, and some of the specifics with that. There's also a link to an ebook I wrote. It's called The Arthritis Solution, but it talks about all kinds of treatments for all kinds of orthopedic injuries, not just arthritis, and not the typical surgery, cortisone, physical therapy stuff. So it can be very helpful for a lot of people. And he says it was not torn off. Then, yeah, I mean, again, it's hard to know. I would think really aggressive physical therapy, but 15 months still having issues, it makes me wonder if it's atrophied for some reason. So that I think maybe you'd think about getting an MRI at that point. That's maybe somewhere where peptides potentially could be helpful to increase the strength of the muscle, improve the healing, that type of thing. All right, I am, there's Cindy put, doctor said foot's rotated out, fibula won't heal, have pain. I don't know, again, if this is a tibia fracture or what. Yeah, again, this is where it's tricky because I can't see x-rays, I can't really give medical advice, and so without knowing what the injury was, what surgery, if there was a surgery, that kind of thing, it's really hard to know how to answer that question. So I apologize. I will be back here January 5th, 2026, the first show of the new year. For anybody that has more questions, I do this, like I said, once a month, and very, very much love doing it. I very much appreciate all of you being here, and I hope you have a great holiday season, and I will see you in 2026. Take care.